massage plantar fasciitis. Okay. The plantar fasciitis is a tear along the fascia in the bottom of the feet. But to release it, we have to release also on this gastrocnemius and soleus muscle. And close to the calcaneus. And sometimes here to the side. Look at this picture. When it comes to pain, the calcaneus part of the feet, this one, is most of the time the pain was 42 to 52%, 37%, 35% along the calcaneus. But on the medial side, the pain is like 14%, and to the lateral side, the pain was 5%. And here is 8%. So there's a sore spot also on this side. So it's a tear in the calcaneus area. And sometimes in the distal of the metatarsal. And the symptoms are pain in the bottom of the foot. Mostly when we wake up in the morning. After we wake up in the morning, that's the time you feel pain on plantar fasciitis or long rest. And the possible cause is because of rapid extension of the foot, or when you're running too much, jumping too much, everything that too much repetition on your muscle, on your plantar, and sometimes having a poor shoes arch. That's also one of the cause. And the other considerations are also tight flexors, tight extensors, or sometimes the toes are crossing over each other. Or sometimes the hammer toe. That can considered also affecting our plantar fasciitis. Okay, let's start to massage the plantar fasciitis. We're gonna get some oil. First, we're gonna do some gliding stroke. So, if there's a plantar fasciitis, sometimes it's on the right area is more painful, and sometimes it's just a little bit on the left. Sometimes it pains only on the right side, and it never had a pain on the left side. So when it happens, when like example, our plantar fasciitis, the affecting area is right side. So the whole 30 minutes, I massage the whole plantar fasciitis, but 25 minutes on the affected area and 5 minutes to the not affected area, so that it calls the balance. And now we're gonna do first gliding stroke. We can also call this our warming stroke. Then just in case our affected area is a right, then this is the one we use. So slow gliding using our knuckle, and here, and this one is most painful area is we're gonna do some thumb friction. Very slow, specific. Then we can do some smashing along the arc of the foot. Then we can do some rotation. Make sure that it will warm good. Then after that, we're gonna do the warming up also the gastrocnemius. can do gliding stroke. Then after some couple, this is a specific thumb gliding, very slow and firm. Do some repetition, very slow and firm. And after that, we also do soleus muscle. Gliding on the side. Then we're gonna do some pin and stretch. We're gonna raise that up, pin the foot, and pin your finger on the middle of below of the gastrocnemius. And while we do the stretching, we're going down on the gastrocnemius. Then release the stretching on the foot. Then release. Then go back at least 6 times. Firm. And while I'm going down with my finger pressure, my feet is stretching, my hand is stretching to the foot. Then release. Do some couple of that. Then release. Then do some bread crumbing side by side. Bread crumbing. That's a good sounds. Then after that, stretch, pin and stretch. Pin and stretch. Pin and stretch. Then do some gliding to release a lot of tightness in the gastrocnemius. Then sometimes we can open up the muscle of the gastrocnemius. We can put this on the shoulder and position your 2 finger set, then slide out. This one is a myofascial release. We're doing myofascial release on the gastrocnemius. The more we slow, the more we release tight muscle. So we don't need to rush. We can do back and forth, getting down and getting up, until we can feel that the gastrocnemius is getting loosened up. Then now do some stretch again. Then this time it's a soleus. Then release. Then do some slide together with your stretch on the soleus muscle. Then release. Do it some couple until you feel the soleus muscle is getting loosened up. Then do some breadcrumb again. Then this time, we're gonna do the whole foot. After we relax the whole soleus muscle and gastrocnemius, now we're gonna focus here on our sole area. We're gonna open the whole sole. So we're gonna do some thumb friction. We're gonna open up the tight muscle, like, then we're gonna do some pin and pressure. Pin and pressure. This is must be need firm and feel the tightness on the calcaneus side of the muscle. to the here. Then it needs, around it, we need to put some multi-directional friction around the calcaneus. Firm and specific. Longitudinal friction, transverse friction, multi-directional friction. We can do A, B, C, D, or even 1, 2, 3, 4, 5, even until 100. We will gonna use the whole 25 minutes to relax this whole feet. Do some gliding stroke towards the calcaneus. And when we do gliding, stop on the calcaneus and pin your pressure. Then after we are sure that the muscle will relax, we can feel it for sure. We'll feel it that it's getting loosened. So after we loosen up, we're gonna go back there to the gastrocnemius. And let's do again to release the tightness on gastrocnemius until we feel this one and this one is lighten up. Then connect up. Before you leave it, connect over here. Then start in here again. Specific. The more it is low, the more we release tight muscle. And the more we slow, the more it deep. And it's, if we are doing like pass like that, it's sometimes it's painful. But if we do very slow, even how deep that was, they don't feel the pain. They feel relaxed. Then when we release, we have to be very slow so that the blood is going there and the oxygen will help us. And when we are very slow in our release, they will feel it. Then do some gliding stroke, warming stroke, or effleurage stroke. Then we'll do the Soleus. Do some couple releasing on our Soleus. Then we will do again the stretch pin. After that, we will finish it with the foot. And the focus area is on the bottom of the foot. But it's the more we release the gastrocnemius and the Soleus, the more we release more on the bottom of the foot. Then after that, 25 minutes, then do some 5 minutes on the other side of the body for balance. Please subscribe to my channel and watch out for more live video that will help the body.